Your veterinarian will select an insulin type, dose, and injection interval that will serve as a starting point for your cat's therapy. There are several types of insulin available for cats. They vary by potency, duration of action, and other factors. This first phase of insulin therapy is the regulation phase. Regulation means finding the proper insulin type, dose, and injection interval to keep your cat's blood glucose between 100 and 300 throughout the day and night. When blood glucose stays within this range, the symptoms of diabetes disappear. The first dose of insulin is typically given during the office visit, where you will be shown how to give your cat his insulin injections. Most cats are then sent home on a low dose of insulin for about a week to allow you and your cat time to adjust to the new treatment routine.
And I would say the very first time I did it on my own, I was definitely nervous. But the syringes, the needles are so tiny, they're so little. And I said after I did it to him twice, after 2 days, and saw how easy it was, right now it's like it's just no big deal at all.
After about a week, your veterinarian may ask you to come back for a follow-up visit. This often involves a short hospital stay to get a blood glucose curve. In this test, your cat is given insulin and his blood glucose level is measured every 2 hours. This test will show how long it takes your cat's glucose to reach its lowest point of the day and to determine the highest and lowest glucose levels of the day. Each cat processes insulin differently. The glucose curve helps your veterinarian tailor the insulin therapy to achieve optimal blood glucose levels throughout the day and night. If adjustments are made to the insulin, you may be asked to come back for additional blood glucose curves in the coming weeks. Your veterinarian will continue to adjust the insulin until satisfied that your cat's diabetes is properly regulated. How long this process will take varies from cat to cat and unfortunately is unpredictable. Although the regulation phase can be a time of frustration and expense, keep in mind that finding the appropriate insulin therapy will prevent many complications for your cat down the road. Between checkups, it's helpful for you to keep a daily log of your cat's appetite, energy level, thirst, and frequency of urination. This information helps your veterinarian to fine-tune the insulin therapy. When your cat's diabetes is well controlled, you should notice his appetite normalize, his thirst and urination habits return to normal, and his energy level improve. Be patient. These improvements can take time.
We were just trying to find the right dosage of insulin for her, and it took a little while to get it down. And I was just amazed that that amount of insulin would do anything to any living creature, but apparently it does.
When your veterinarian is satisfied that your cat is on the appropriate insulin therapy, your cat enters what's known as the maintenance phase. During maintenance, the insulin type, dose, and injection interval don't change, and your cat has the appearance and behavior of a normal cat. In the maintenance phase, your cat will need to see your veterinarian approximately every 3 to 6 months to ensure that his insulin needs have not changed. Your veterinarian may wish to perform a blood test known as a serum fructosamine. This test provides a snapshot of your cat's diabetic control over the previous 2-week period. If the fructosamine level is normal and your cat is doing well, he will continue in the maintenance phase and the insulin therapy will be the same. If the fructosamine level is elevated, your veterinarian may wish to adjust the insulin therapy. Between veterinary visits, it's very important that you continue to monitor your cat closely at home for signs of trouble. Any drop in appetite, sudden weight loss, increase in thirst and urination, or decrease in energy level require an immediate recheck with your veterinarian.